respected Sharda ma'am, and thank you for giving me this opportunity. Who is teacher of teachers, and respected Vandana Gupta ma'am, Secretary Delhi Gynae Forum, Dr. Renu Chawla
Hey,
ma'am.
madam, she's the president. Galti ho gayi,
Sorry,
she's the
President ma'am and Dr. Renu Chawla, Secretary. Thank you very much for this opportunity. And now, and thank you for the great presentation, my previous speaker. Coming from the urogenital gynecology to a more complex, more physiological problem and more social problem, sexual behavior and practices among the adolescents and young people. So it is very important because 50% of the population of India is below 25 years and 25% of the population is below 14 years. So that is why taking our attention to this group of people is so important. And जैसे हमें हाथ पकड़ के road cross करना सिखाया जाता है, ऐसे ही how to navigate into this behavior, the sexual behavior, which is very natural to come to everyone, देखते हैं. So adolescent sexuality is a developmental stage where the teenagers experiences and explore the sexual feelings, often intensified by the puberty. Sexual interest can be manifested by various behaviors like flirting, kissing, masturbation, or partnered sex. Adolescence and the young age is a time of opportunity and risk. यानी कि वो बहुत अच्छा भी बन सकता है क्योंकि इतनी एनर्जी, इमेंस एनर्जी है, and खराब भी बन सकता है depending upon the choices that adolescence chooses. During this time, attitudes, behaviors, values that forms a young person's future begin to develop and shape them. And the World Health Organization estimates that 70% of the healthcare related issues in the adults are largely due to the behaviors that initiated during this period. Let's now come and see what age groups they are. Adolescence comprises from the age groups of 10 years to 19 years, youth is from 15 years to 24 years, and young people is from 10 years to 24 years according to WHO. Coming to the factors contributing to the adolescent and youth sexual behavior. First is lack of sexual knowledge. Sexual education often is a taboo in India, especially in the rural areas, including the misinformation and unsafe sexual practices. It is very disheartening to know that only 4% of the young men and women they report to receive sexual education in the rural areas. Social culture norms, premarital sex is often stigmatized in the rural areas, yet many people there engage in the premarital relationships, increasing in the STIs and unintended pregnancies. Poverty can also limit the access to education. Risky sexual behavior, unmarried youth in India, including inconsistent condom use, unprotected sexual activity, and multiple sexual partners, increasing the risk of STIs, HIV. Among the sexually active group, unmarried youth, 15 to 29 years were 4% of women, 23% of men, and have more than one sexual partners.
Anita Yadav.
And there were 17% of the men who have paid for sex, according to the Handbook of Youth Development. Influence of age and education knowledge of sex and sexuality is significantly higher as the age and education increases. Unhealthy sexual behavior are characterized by early age of sexual initiation, unsafe sex, and multiple sexual partners. Let's see the common sexual behavior. It is a spectrum from abstinence to partnered sex. Masturbation, prevalent behavior in 46% of the boys and 24% of the girls. It allows the youngster to explore their own sexuality, and it is very normal. Sexual fantasies are seen in 72% of the adolescent, and young acknowledge the sexual fantasies which will serve to understand their own desires, and they will rehearse them with the potential sexual encounters. Partner sex, we all know, include kissing, fondling, oral sex, penetrative sex. Many adolescents also engage in the non-coital behavior nowadays because of the, they use so much of media that is known as sexting. Wherein you all know this. Sexual functioning, pleasure is a key motivator. Male tend to emphasize more than the females. Compulsive sexual behavior is also seen, which is having an intense preoccupation of sexual fantasies, urges, and behaviors that cause distress and impaired functioning. Excessive pornography, risky sexual behavior, and sexual objectification. Risky sexual activities carries risk of STIs, unwanted pregnancies, and can be reduced by safe sexual practices. Pornography, many studies indicate that adolescents engage in these since the age of 14, and excessive consumption may lead to unrealistic expectations and unhealthy sexual behavior as unsafe sex, multiple sexual partners. So now, what are the challenges? First is the curiosity, because they are very curious, they are very experimental, and there are gush of hormones in their in the teenagers and the youngsters. And it is very heterogeneous group. Heterogeneous as in sense like there is a spectrum of the age, different type of sex, and different social and cultural people are there. So a lot of heterogeneity is in the group. That is also a challenge. There is a taboo around, and the people consider these age groups as inexperienced minors. अरे तुम्हें क्या जरूरत है इन सब चीजों की पूछने की, मतलब these are the taboos around in India. Peer pressures, like the friends of that adolescent, they force them to to be in those activities. Lack of knowledge, high energy in these age groups. Attitude of providers, like we have to be very humble and we have to be very non-judgmental in these treating these peoples. And the legal barriers, we will talk about it. So according to one study which was done in the northern part of India, and we also remain in the northern part of India, and it's a very recent study, and 2021, I think, was conducted in Faridkot and Ludhiana, which says that when the question regarding the use of contraception was asked, the most contraception used was condom, and the non-usage was 68%. And when asked why they don't use it, then the answer was that they didn't feel good, 42%, and contraception was unavailable, 31%, and they were unaware of contraception, 18%, and 65% of the people don't even ask about the contraception with the partner. So what are the barriers to use contraceptive services in adolescent? Law and policies, gender and social norms, misconception and lack of knowledge, financial barriers, lack of privacy and confidentiality, and provider bias. So WHO has, formed a system. So for the approach to the adolescent responsive contraceptive services. So herein, the age and sex is asked, and the service delivery is done. Information services is available, and the audiovisual privacy is ensured for that adolescent, and the confidentiality is maintained. Access to the essential medicine, full contraceptive methods are, the adolescent is educated about them, including the emergency contraception and long-acting reversible contraception. Then health workforce, these are non-judgmental and confidential services are given. This is very important. Then now the financing, because they don't have money, they don't earn, so the services are provided free or very subsidized. And this is very important, that they are included in the leadership and the governance. Actually, we don't know how many मालूम कि adolescents की क्या problem है. We have to incorporate them, involve the adolescent, and in the service design, in the implementation and the monitoring. So this has been designed by WHO. In the same study which was conducted in northern part of India, Faridkot, the participants were asked about the type of sexual partner. So 62% were having stable sexual partner, 15% liked the partner whom they were having sex with. Casual sexual encounters were 23%. And when coming to the length of the relationship, One night stand was seen in 9%, 1 to 3 months, 27%. More than 4% was seen in 64% of the couples, in which 74% of the females of the total female study population were there, and only 59% of the males were there in 64%. So coming to the sexuality, only three types of sex were evaluated in this study. Heterosexual were 54%, homosexual were 22%, and bisexual were 24%. So now coming to the sexual orientation change among the adolescents. This is a systematic review. Adolescent and the youth identifying with the non-heterosexual orientation or a sexual minority at baseline were more likely to report a change in the sexual orientation. And studies also reported the impact of changes in the sexual orientation on their behavior and health outcomes. The adolescent who reported either non-heterosexual orientation at the baseline or shift towards the non-heterosexual orientation had a great likelihood of reporting depressive symptomology. So this is also related to the mental health and suicidal tendencies, substance abuse, as compared to who did not report any change or who were heterosexual. Coming to the same study, now see what was the reason of this sexual behavior. 71% of the participants have the partners who were elder to them, especially the female one. 45% were having multiple sexual partners. 65% attributed to their behavior to fun. Like 65% of these young population were performing sexual activities just for fun. 23 having urge, and 12% only because of peer pressure. Majority of individuals, 46% had vaginopenile intercourse, 26 had vaginopenile anal intercourse, 19% have anal intercourse, 6% has anal oral along with the vaginopenile, and 3% had anal oral intercourse only. 76% of individuals do not report any symptom after intercourse, but 24% reported burning and discharge. So now coming to the unwanted pregnancy, studies have shown that within 24 months of first intercourse, 36% or more than 1 out of 3 premarital sexually active teenagers become pregnant. It is a very good, very high numbers. The difference between those who have always used methods of contraception and those who haven't used them, the difference was substantial. That means the education has to be given to them. Within the first 3 months after intercourse, 20% got pregnant who never used contraception, as compared to 4% who did it. So these are some of the risk factors. Now coming to the sexually transmitted diseases. The adolescents are in a unique period of psychosocial and biological development, placing them to a high risk of STIs acquisition and transfer. Some STIs are more prevalent, like chlamydia, Neisseria. They are more common in age group less than 25 years of age, then leading to PID, leading to ectopics later on. So we have to take care of these set of people. Unfortunately, many providers who care for adolescents fail to discuss sexuality even at the healthcare maintenance visit. So this is very important to talk about the sexuality and sexually transmitted diseases at the same health visit. Primary healthcare visits presents opportunity to educators to educate adolescents on the sexual health and discuss the healthy relationships and promote the prevention of HIV and STIs. So now risky sexual behavior and substance abuse, where these youngsters are sexually active. What is the relationship? There is an evidence that as many as 21% of adolescents are engaged in the substance abuse during the most recent encounter. Research have shown that relatively to their non-substance using peers, adolescents who regularly use abusive substance are more likely to become sexually active at an earlier stage. And they also have multiple sexual partners and more likely to have an unprotected sex. Furthermore, substance abuse has been associated with the increased risk of STIs, particularly STIs. Now, coming to the association between the social media, which is very important. Nowadays, the adolescents are totally on the social media every time, and sexual behaviors. The adolescent develop a multifaceted influenced by social culture and even nowadays technological factors. Social media use amongst the adolescent had been found to be significant impact on their sexual behaviors. So first, let us see about the positive impacts. So positive impacts are the improved understanding of their sexual roles and consequences, safe sexual practices. They know about each other, like females got to know about the male physiology and anatomy, and male got to know about the female. That is very important. And improved psychological well-being. Now coming to the negative impacts. Negative impacts include sexual abuse, same-sex sexual activity, pornography, multiple sexual partners online, and sexual dissatisfaction. A systematic review of studies found that the social media exposure is related to sexual attitudes, behavior, initiation, and risk among the adolescents, highlighting the need to educate adolescents about the negative risk of social media exposure on the sexual attitudes and behavior. Another study showed positive correlation between the social media use and engagement in the risky behaviors. So now coming to the mental health. So mental health is very much related to the sexual health. So researchers have indicated that a significant link between the adolescent sexual behavior and mental health problems. Studies have shown that adolescents experiencing mental health issues are more likely to engage in the risky sexual behaviors, including early initiation of the sexual activity, having multiple partners, unprotected sex, potentially leading to negative consequences like unintended pregnancies and STIs. Engaging in certain type of sexual activity, particularly without adequate support. So support system is not there, then or understanding is not there, then contribute to development of mental health problems like depression, anxiety. And this is bit gender biased. It is more seen in the females. Now, it has also been seen that if there is a healthy sexual relationship, within the supportive environment where there is the partner is also supportive, your family is also supportive, this can be positive for the adolescent development. So according to the WHO, 63%, this is very important, I found it from WHO guide, 63% of all the societal deaths reported in India were in the age group 15 to 39. Suicide ranked first in India as a cause of death as compared to third rank, which is global is a third ranking. But in India, it is a first ranking. And there was an increase in the 40% in the number of suicidal deaths from 1990 to 2016. So it is a huge amount. We have to look after it. And somewhere or the other, the sexual health is also responsible for these suicidal rates. So now coming to the body shaming and all, the shame is a deep emotional state resulting from the belief that oneself is inherently flawed or undesirable. The adolescent time is a very vulnerable one and marked by significant physiological and emotional changes. So making this demographically particularly susceptible to the harmful effects on the body shaming. So the data from various studies indicate a concerning prevalence of adolescents, especially females, at a higher risk of abdominal obesity. This physical characteristic is not only a matter of concern on their immediate health, but also serves as a potential trigger for body shaming, which again affects the mental health of the individual. These findings underscore needs for the intervention that promotes positive body image and self-esteem in this group. So coming to the intimate partner violence in youngsters, in the young population. So according to the Lancet Child and Adolescent Health, globally 24% of the adolescent girls who have been in relationship have experienced intimate partner violence at least once in lifetime. Factors that contribute to the intimate partner violence include poverty, lack of education, exposure to domestic violence as a child. Intimate partner violence can lead to depression, anxiety, substance abuse, and mental health condition, and also cause injuries, unplanned pregnancies, sexually transmitted diseases. So programs that teach healthy relationships This is a soft skills that teach healthy relationship skills, promote social norms that protect against the violence and create protective environment against to reduce the intimate partner violence. Coming to the sexual assaults in this young population, adolescents who experience sexual assault are very high levels of pre-existing vulnerability. That means they would have experienced this before also, an exceptionally high rate of psychiatric disorders and comorbidities at 4 to 5 months after the assault. The most of the participants perform the most deprived group of population, and 50%, this is very important, 50% only lived with one of the parent, and 19% had a special educational needs. This also has to be looked out, and 51% has assessed mental health 12 months before the assault. So I have tried to cover all the aspects of adolescent sexuality, and one more is there that in cases of people who have special childs, the sexuality I have not covered. It's a very subtle topic. So what is now our role, how we can help to the society in adolescent sexuality and in their mental health, in their sexual health? So we should have an integrated counseling services. We should educate and counsel them at the full range of issues of puberty, menstruation, night falls in case of boys, masturbation, consent, because they have a guilt also कि masturbation normal नहीं है, night fall normal नहीं है. So we have to tell them this is all also a phase of, you're growing up. It is just a part of that phase. द कंसेंट इज वेरी इंपॉर्टेंट. हम अपने बच्चों को सिखाएं कि आप किसी के कंधे पे हाथ रखते हैं, सो टेक द कंसेंट. क्या मैं आपके कंधे पे हाथ रख सकता हूँ? क्या मैं आपके गालों को छू सकता हूँ या छू सकती हूँ? सो कंसेंट इज वेरी वेरी इंपॉर्टेंट. So it has to be taught by the parents or the healthcare workers. Intimate partner violence, that has to be looked by the healthcare providers. Gender biased violence, conception, contraception, we have to see, abortion, and we have to give the services for the STIs. Menstrual hygiene and health, we have to see, that we all cover. Provision of contraception. So ma'am, this is very great topic. We should be non-judgmental in giving the emergency contraception and everything, but the law doesn't allows us. I have taken this. Yes. So safe abortions also. The young women are able to avail safe abortion up to 20 weeks of gestation under circumstances mentioned in MTP Act. So they should also get the post-abortion care and all. So if the young clients, what have to be done for the young clients if the age is 18 or less? So the POXO Act comes in. And we are told that we have to give contraception. Now the POXO Act says that we have to report to the police or administration if these patients come to us. So this is very contradictory and a gray zone here. We will talk about it. And if it is more than for 18 years, the normal has to be followed and no consent of the parents has to be taken. If the patient is more than 18 years, we can just do with the consent of the patient only. Maternal health services. Teenager mothers are also coming. So respectful, non-judgmental, evidence-based maternity care should be given to these mothers. And prevention of RTIs and STIs should be done, and easy referral system should be there. We should screen and treat and refer. And diagnosis of other sexual reproductive health should be done, as hirsutism, menstrual disorder, PCOS, early detection of pregnancy and all. Care of the survivor of violence. So taking care of the victims of rape, intimate partner, giving them tender love and care. Violence, sexual abuse. Abuse can be of any type, physical, mental, emotional, or sexual. We have to see by the body language or doing the physical examination or taking the history. Strengthening the healthcare sector response to violence. We have to do this. Recognizing the sign of violence, as I told, by history or examination. So first we have to learn this, that we have first aid should be first given. We have to give first aid first, and then we have to report in case we need to report that case. Establishment of referrals to the government and non-government institutions should be strengthened, and interconnection of the sexual and reproductive health to the mental health, as we have discussed. It is a most unaddressed problem we as a physician should understand and treat. So, in the view of evidence of widespread sexual activity among the Indian adolescents, young adults, implementation of following strategies will lead to widespread positive results. Parents, guardians, and healthcare providers should educate to overcome the cultural barriers that discourage giving the adolescent early sexual education at home. Advocacy and community mobilization to increase the awareness towards the need of inclusion of sexual education, effective health education programs targeted that we are doing, but we have to strengthen them more. And while where abstinence may not suffice, improvement of contraceptive counseling so as to increase the contraception, and in view of overwhelming influence of peers, training of peer education to transfer correct information to their peers. So thank you for the patient listening.
Dr. Vani, you've done a great job. Wonderful. Wonderful. I think, all of us go wiser.
Ma'am, any questions? And we can
You just stop
discuss, I think we can
presentation.
discuss this important topic.
So I will like Dr. Vandana to make comments, Dr. Deepti Naab to make comments, and I can see Divya Singhal here, Dr. Chandrakanta make comments. Dr. Vandana, you want to say something? Deepti Naab?
Hi, Divya ma'am.
Ma'am, I want to say something.
Yes.
Many times the females are scared. They are plus 18. They came for the abortion, but they don't want to tell their parents about anything. But we doctors are said, नहीं हमको तो तुम्हारा parents भी चाहिए because you are unmarried, you are 18 plus. They were just borderline 18. What to do in that cases?
डॉक्टर साहब, एक बात मेरी आपको सिंसियर एडवाइस है. आई एम सरप्राइज व्हाई वानी सेड, एक तरफ तो आप बोलते हैं कॉन्ट्रसेप्टिव दो, दूसरी तरफ आप पॉक्सो एक्ट करते हैं. वी हैव टू फॉलो द लॉ ऑफ द लैंड. We have to follow
no,
the
ma'am,
law.
but what to follow? There's a gray area. I wanted to ask you this.
No gray area, doctor. We can't distribute contraceptive because we don't want them to have sexual activity.
Yes.
खत्म हो गई बात.
Ma'am,
She has खत्म हो गई बात. 18 साल से पहले.
Ma'am, the pay will continue, ma'am.
Ma'am, but
a lot of adolescents are coming, and if you say no, they will continue and they will come to
Dr. Vani, in many schools, they are having Conti party at the class of 12.
Yes.
Anna said they need contraceptive advice. I have given.
Madam, you have to do something about it. Like, means you can do, because once they say that contraception nahi dena, and then they will come with the pregnancy. It's very contradictory, ma'am. It's very contradictory. And
contraception में अभी नहीं जाएंगे. What I will definitely say, it is a fundamental right, and we need to teach them. आपने खुद ही बताया कि आज की तारीख में पेरेंटल गाइडेंस कम्स ओनली 5%. स्कूल्स वगैरह हैं 10% में. स्कूल में सेक्सुअल हेल्थ थी. पहले हम लोगों ने इसको एडवोकेट किया था कि 100% में देना पड़ेगा. हमारे बीजेपी ही वाले लोग अपोजिशन में थे शीला दीक्षित के टाइम पे. उन्होंने मना कर दिया कि नहीं होगा. खत्म. नाउ एक क्वेश्चन इज, फ्रॉम द टाइम वी हैड Minaki and the time now, it is 10.5 years. So नेचुरली जब अर्ली ऑनसेट ऑफ प्यूबर्टी हो गया तो क्यूरियोसिटी तो आएगी.
करेक्ट मैम, करेक्ट.
बट एक बात बिल्कुल क्लियर है कि हमारे नॉलेज गैप्स बहुत है. हमारे पास ये जितने सारे लोग आप बैठे हैं, एक होता है लाइफ स्किल्स. लाइफ स्किल्स की वर्कशॉप अगर हर एडोलेसेंट को कराई जाए तो वो कभी भी रिस्की बिहेवियर नहीं लेगा. आपने कंसेंट की बात करी है कि किसी के में हाथ रखना है तो आप हाथ रखने की बात करते हो. डॉक्टर मैं आपको छोटा सा एग्जांपल एक दूंगी. यहाँ पे बिजनेस स्कूल है, बहुत ही फेमस है, दिल्ली में नंबर 1 है. उसके प्रिंसिपल के पास हमने कहा हम आपके यहाँ पर वर्कशॉप करना चाहते हैं. उन्होंने कहा नहीं डॉक्टर साहब, हमारे लड़के बच्चे बहुत हैं, उनको जरूरत नहीं है आपको. अच्छा ठीक है. तो रिजल्ट निकलना होगा, 4 बजे रिजल्ट आना होगा. 4 बजे रिजल्ट नहीं आया यूनिवर्सिटी से, तो लड़के लोग भी बैठे रहे, लड़कियां भी लोग बैठी रहे. तो 8:30 बजे के करीब जो है रिजल्ट आउट हुआ. तो उसने कहा कि डॉक्टर साहब There were 50 pairs. The girls were hanging in the neck of boys.
Yes, ma'am.
उनकी नेबर थी डॉक्टर लक्ष्मी, उनसे कहा वो डॉक्टर शारदा जैन को बुलाओ हमारे यहाँ पर ये ले. So what I'm trying to say, where is the consent kind of a thing? हमारा समाज बहुत
Ma'am, nowadays the adults, they don't hesitate to touch anything. गले लगना तो is very common, like mothers. They don't feel feelings नहीं है ma'am. They just enjoy the company only.
But डॉक्टर साहब, मैं आपको छोटे से मिथ्स की बात कराती हूँ. मैं हिंदुस्तान के मिथ की बात करती हूँ. एक वो कहते हैं कि फर्स्ट टाइम सेक्स कैन नॉट कॉज प्रेगनेंसी. एक उनके दिमाग में बैठ गया. और ये लोग दे टेल पार्टनर्स है ना, एंड वो कैसे कॉन्ट्रसेप्शन अगर हम यूज करते हैं तो इट विल कॉज इनफर्टिलिटी. आपको समझ ही नहीं आता है. एंड वी नो दैट हाइमन हैज नथिंग टू डू विद द सेक्सुअलिटी.
Ma'am, एक और myth है, if you are doing sexual behavior during periods, during menstruation, you will not get pregnant. जैसे डॉक्टर साहब हमने तो during periods किया था, पता नहीं कैसे हो गया ये.
एंड ये जो बड़े लोग हैं उनके अंदर ये है कि उनकी बीमारी सेक्सुअली ट्रांसमिटेड डिजीजेस ठीक हो जाएंगी अगर वो यंग लड़की से सेक्स करते.
बताइए,
ये उनके दिमाग में ये. तो एक बात है, ये जो हमारे मिथ्स हैं, हम लोगों को जब तक बैठ के इनसे बात नहीं करेंगे तो बात बिल्कुल क्लियर है. फैक्ट्स मैडम ने ऑलरेडी बता दिए. 50% ऑफ HIV एंड AIDS आर इन लेस देन 25. 50% ऑफ STIs आर लेस देन 25. सो अगर दैट इज द थिंग, तो आपको वहां पर बात करनी है, अपने बच्चों के साथ बात करनी है और पब्लिक प्लेटफॉर्म में आकर लोगों को इन्फॉर्म करना है. पब्लिक प्लेटफॉर्म में आना है. नहीं तो डॉक्टर साहब फिर आइए रिपीट, 98% of the YouTubers who talk on health are non-medicals.
True.
पहले तो हम अपनी इंफॉर्मेशन पूरी करें कि भी हमारे पास इंफॉर्मेशन. जिसने डॉक्टर साहब हर आदमी जिस सब्सटेंस अब्यूज है, मैडम ने बताया, वो सब्सटेंस अब्यूज करेगा तो वो सेक्स में इंडल्ज करेगा, मल्टीपल पार्टनर में इंडल्ज करेगा. तो प्रॉब्लम वहां पर है. हमें अपने बच्चों को देखो, अपने नेबरहुड के 10 बच्चों की बात करो. आई रिमेम्बर डॉक्टर दीपा सिंह, उन्होंने ये जितनी भी ईरानियन लोग हैं उन लोगों को यही क्लास लेती थी. डॉक्टर साहब कुछ तो हमने पैशन बनाना पड़ेगा डॉक्टर साहब. और खाली कहना जब वी हैव टू फॉलो द लॉ ऑफ द लैंड. ना तो आप कंसेंट दे सकते हो, आपने कंसेंट आपकी मर्जी से हो गया तो भी ये वैलिड नहीं है. आप अपना MTP के लिए भी कंसेंट नहीं दे सकते. बात तो खत्म ही हो गई. एंड डॉक्टर साहब अगर आप फॉलो नहीं करेंगे तो 6 महीने आपको जेल हो जाएगी, फाइन लगेगा आपको अलग.
यही तो प्रॉब्लम है. यही तो
मैं कुछ कहना चाहूंगी.
हाँ जी डॉक्टर दिव्या सिंह.
हाँ, मैं ये कहना चाहूंगी मैम कि आजकल के सेक्सुअल एपिडेमिक और सुसाइड एपिडेमिक, मेंटल इमोशनल हेल्थ जो इतनी डिग्रेड हो रही है स्ट्रेस के जमाने में, वी हैव टू as providers of health providers rather, we have to befriend the girl who comes into our clinic for any cause. वो PCOD के लिए आती है, irregular periods के लिए आती है, मोटापे के लिए आती है, एक्ने के लिए आती है, किसी भी चीज के लिए आती है. वो इतनी डरी सी सहमी सी एक डोमिनेटिंग मदर के साथ आती है यूजली, या फिर ज्यादा वोकल है, whatever her way of मतलब जो भी उसका है तरीका, बिहेवियर है, हमें उसकी फ्रेंड बनना है. जैसे एक पहले एक फेमिना मैगजीन आती थी, पहले की जो मैगजीन है उसमें एक एग्नी आंट का होता था कि मेरे को ये बॉयफ्रेंड मेरे को अट्रैक्ट कर रहा है, इमोशंस इस समय हाई होते हैं प्यूबर्टी के समय, तो मैं क्या करूं, मेरे को ब्रेकअप करना है, मैं क्या करूं, मेरा बॉयफ्रेंड सेक्स मांग रहा है, मैं क्या करूं. तो ये सारी चीजें, हाँ, तो ये सारी चीजें किसी हद तक हम लोग उनसे अगर दोस्ती सी एक मतलब ओपननेस दिखाएं. एक तो होता है कि ये देखो ये लड़की आ गई और शी इज प्रेग्नेंट और शी इज सेक्सुअली एक्टिव, तो हम लोगों को लगता है अरे बाबा रे. वह एक है कि दिस इज द नॉर्म दीज डेज, बट मेक फ्रेंड्स विद हर, ट्राई टू, देन यू विल बी एबल टू एक्सटेंड योर thinking to her, once you have made friends with her. हम अपने बच्चों को तक नहीं बता सकते, दूसरों को तो 2 मिनट की जो हमारी या 10 मिनट की वार्तालाप होती है उसमें कितना बता सकते हैं. तो इसलिए ये बहुत जरूरी है कि हम अपना माइंडसेट को बदलें एंड ये सब चीजें उनके लिए करना शुरू करें. और मैम तो हमेशा इतने दिनों से हम लोगों को बोल रही है कि यूट्यूब पे बनो, कुछ बताओ. तो आई थिंक हम में से थोड़े लोगों को, और डॉक्टर वानी आप, डॉक्टर रुचि आप, सबको हमें यूट्यूब पे
Madam, please
जाना
stop
चाहिए.
presenting, doctor. Doctor,
Ma'am,
stop presenting.
ma'am, I just want to say one thing. That is why I presented this. ये एक मैनुअल है मैम, ये वाला. इसमें केस वाइज लिखा है, लाइक केस वाइज हमें कैसे करना है, क्या इसने गलत किया. इट इज वेरी वेरी गुड मैनुअल, केस वाइज प्रेजेंट किया हुआ है. Every जो मैम बोल रहे हैं,
मैंने I think, you know, if it is a government of India book, we should definitely see. If it is outside book, then
yes
probably
ma'am, this is
government
ma'am,
of
this
India
is,
book is this.
yes ma'am, this is
मैं
this.
डॉक्टर दिव्या आपको बताना चाहती हूँ, my interest in adolescent health has been from 2000. I feel, and we had made the manuals and did everything, but you know, there are many governments which stop it. They feel that if you discuss it openly, that promiscuity वैसे ही बढ़ी हुई है, और बढ़ जाएगी, खत्म. तो एक बात बिल्कुल क्लियर है, आज की तारीख में जब यंग लड़की आती है, मोस्ट ऑफ द गायनेकोलॉजिस्ट आर फ्रेंडली. वो डेज खत्म हो गए दिव्या सिंगल. एक बार आप फ्रेंड, और आपको ये गलत फहमी होगी कि वो डर के आती है. कोई डर के नहीं आता.
नहीं,
वो टाइम खत्म हो गए. वो 20 साल पहले टाइम खत्म हो गई कि वो डर के आती थी. आप कोई डर के नहीं आते.
मैडम पहले के टाइम में जब हम पीवी करते थे तो हस्बैंड उठ के बाहर चला जाता था. आज के टाइम में कोई
से काम नहीं होता. बहुत लोग सोचते हैं करना, लेकिन एक्शन हैज टू बी देयर. यू हैव टू वॉक द टॉक. पहले खुद सीखो, पहले उसको सीखो, फिर करो. आज मुझे एक जगह बता दो जहां पर फॉक्सी की एडोलेसेंट हेल्थ वर्कशॉप हो रही है.
मैंने लेक्चर्स लिए एमबीए में. जेडी वाला कॉलेज है, जो स्कूल्स हैं 10th and 12th के, ऑन सेक्सुअल एंड कॉन्ट्रासेप्टिव हेल्थ.
डॉक्टर रुचि सिंगल,
so many
वर्कशॉप अटेंड करनी पड़ेगी. आपको वर्कशॉप अटेंड करनी पड़ेगी. बहुत केस सिनेरियोस हैं कि भैया आपके पेरेंट्स चले गए, उसी टाइम वो लड़का आएगा किताब देने आएगा.
मेरा अगला सवाल यही है कि आई हैव टेकन लेक्चर्स बट आई डोंट नो एग्जैक्टली, तो वेयर इज द वर्कशॉप. मुझे करना ही है, वो कैसे कर सकते हैं?
डॉक्टर साहब, दिस इज व्हाट आई एम ट्राइंग टू टेल यू. आई विल इंट्रोड्यूस यू टू द ग्रुप. ऑटोमेटिकली वो कर रहे हैं, पर वो जितने आजकल कर रहे हैं वो पीडियाट्रिशियन कर रहे हैं. गायनेकोलॉजिस्ट ने अपना पल्ला झाड़ लिया. वो बोलते हैं प्लेटफॉर्म में आके, डॉक्टर साहब फिर कॉन्ट्रासेप्टिव की बात करेंगे, फिर इसकी भी बात करेंगे. फॉलो द लॉ ऑफ द लैंड भाई डॉक्टर साहब. हम आप जैसे लोगों को बचा नहीं पाएंगे.
बिल्कुल.
तो इसलिए आई थिंक इट हैज बीन वेरी एनलाइटनिंग. ये मुझे बताइए कि नाउ द वुमेन्स डे इज कमिंग, तो उसमें क्या कंट्रीब्यूशन हो सकता है, यू नो, एम्पावरिंग गर्ल्स के अंदर? डॉक्टर वाणी.
यस मैम, यस मैम.
यस नहीं, आपको सजेशन देनी है.
I will text you, ma'am. I'll think and I'll text you. I'll text you.
ठीक है. डॉक्टर चंद्र, you want to say something before we wind up?
मैं तो इतना कहना चाहती हूँ कि लड़कियों को ये कॉन्ट्रासेप्टिव एंड ऑल की नॉलेज तो बहुत है आजकल. ये इधर कोंडली की तरफ कोई स्कूल है, उसके सामने ही बिल्कुल एक केमिस्ट शॉप है. तो मुझे एक एमआर ने बताया कि ये उस मतलब वहाँ खड़ा होगा ना केमिस्ट के पास, एमआर जाते ही है. तो उसने बोला थोड़ी देर रुक जा, अभी छुट्टी होने वाली है इस कोएड स्कूल में. तो यहाँ उसने 2 टॉफी के और 2 ये जो इमरजेंसी कॉन्ट्रासेप्टिव पिल के ना बॉक्स रख दिए. पौने घंटे के अंदर वो छुट्टी होने के बाद 40 मिनट में वो दोनों बॉक्स खाली. मांगती हैं आके वो टॉफी है, फिर वो भी लेते हैं और वो भी लेती हैं.
सुन लिया आप लोगों ने?
क्या बात है।
तो मैं आई वाज
Very
शॉक,
common
क्या
one.
था वो 2 बॉक्स मेरे खड़े खड़े खत्म हो गए।
सुन लिया आपने डॉक्टर रुचि,
जी मैम।
डॉक्टर दिव्या सिंगल,
ये लड़कियां
डॉक्टर वाणी,
14-15 से ऊपर के एज ग्रुप वाले।
आप कह रही हैं डॉक्टर रुचि सिंगल,
हाँ जी मैम।
लोगों का आज की पॉकेट मनी का यही सोर्स ऑफ वो है, पॉकेट मनी।
हाँ, वो
Correct.
स्पेंड इसी पे कर
ये
रहे
तो
हैं।
ट्रू है मैम, ये तो वेरी मच ट्रू है कि सोर्स ऑफ पॉकेट
मैं-
मनी तो यही है।
Doctor Sahab, I had 2-3 girls who had come to me for MTP. They were sick of these kind of life of theirs. उनकी पूरी फैमिली इसी एक्टिविटी पे चलती थी। मतलब parents were had become so dependent, the brothers and sister had been so dependent that they will have a free money from this particular girl. तो आज की तारीख में पानी बहुत सिर से ऊपर हो गया है।
ऊपर हो।
हाँ, but you know, looking at things, I feel थोड़ी सी morality बाकी है, इतना ऊपर नहीं हो गया, क्योंकि जो चीज गलत है उसको हम लोग ज्यादा लोग गाते हैं, और जो चीज अच्छी बात है
Correct.
उसको हम हाईलाइट नहीं करते।
Correct.
बट यस चंदर, आई एम नॉट सरप्राइज एट ऑल।
हाँ, पर मैं तो थोड़ा इसलिए थी कि देखो, नहीं मैडम आती भी है, मदर बाहर बैठी है, सारी डिटेल आके अंदर बता रही है, पर मदर को आने नहीं देती। मदर बाहर बैठी है वेटिंग रूम में, वो मेरे
मैडम
साथ आके अपनी
मेरे
सारी
पास मेरे पास कपल ऑफ पीपल हैं who have had HPV पॉजिटिव, CIN1, CIN2, और उससे चक्कर में जब ये वाली चीजें होती हैं तब वो परेशान हो जाती है कि उनको क्या करना है। एंड आई फाउंड द पेरेंट्स हैड कम, they're feeling sorry about it, but now because they have to get the treatment and they love that particular child, तो कुछ क्या करते होंगे मुझे मालूम नहीं, but they bring for the treatment। मेरे हिसाब से तो डॉक्टर साहब, जब when these people are growing up, बहुत क्लोज मॉनिटरिंग चाहिए, both by the mother and the father।
Yes, ma'am.
I passed that particular age, and मेरे साथ जो 2 कुलीग काम करते हैं उनके भी बच्चे बड़े हो गए, but I feel the younger generation is bad।
मैडम मुझे लगता है
I don't agree with doctor, they think they feel shy, they don't feel shy
No,
at all।
I don't feel.
शायद तो नहीं मैम, मुझे लगता है कि आजकल जो ये वर्किंग फीमेल्स का सिनेरियो है, मोस्ट ऑफ द फीमेल्स आर वर्किंग, दे डोंट हैव टाइम टू सी देयर गर्ल्स। पहले आया लेती है तो जो नॉलेज मिलती है बच्चों को वो सारी गूगल से या अड़ोसी पड़ोसी या फ्रेंड से मिलती है। दे आर नॉट गेटिंग अ प्रॉपर नॉलेज।
Ma'am, we are not discussing. Ma'am, we are not discussing with them.
सेक्स एजुकेशन अलाउ नहीं करता डॉक्टर साहब स्कूल।
हाँ
10% में सेक्स एजुकेशन है, पेरेंट्स 5% बात करेंगे तो कहाँ से सीखेंगे डॉक्टर साहब? मुझे वो मालूम नहीं है, बट आई थिंक क्वाइट अ फ्यू ऑफ यू मस्ट बी नोइंग there's a program going on and which is very popular on the TV। वो इतनी गंदी भाषा बात करते हैं कि हमारे जैसे और आप जैसे सुन नहीं सकते।
Yes, ma'am. I have seen YouTube पे. Yes.
क्या नाम है उसका?
मैम नाम मुझे पता नहीं, उसमें एक डॉक्टर भी है, शी इज अ डॉक्टर, आई नो
ये
हर।
सब बॉलीवुड के लोग हैं डॉक्टर साहब, बॉलीवुड के लोग हैं डॉक्टर साहब।
प्रोग्राम बनते ही नहीं है आजकल, जितने भी OTT प्लेटफॉर्म्स पे हैं।
मैम दैट इज फॉर पॉपुलैरिटी ना, अगर वो बात
हाँ,
नहीं करेंगे वैसे
नहीं,
तो
लड़की
popularity कैसे
अगर
मिलेगी?
गंदी
Likes
वाली
कैसे?
गाली नहीं देगी तो वो प्रोग्राम नहीं चलेगा। आप ये देखिए, मतलब आई हैव सीन मेनी, लड़की ही गाली देगी, लड़के तो दे या ना दे, लड़की जरूर गाली देती है और ड्रिंक करती है, फूकती है, ये 3 चीजें जरूर है।
एनीवे रुचि, हमने पॉजिटिव बात करनी है, अपनी सोसाइटी की
जी,
नेगेटिव
मैम।
बातों को ब्लो अप नहीं करना। हमने
Yes.
अपनी सोसाइटी की
नहीं,
पॉजिटिव
मैडम, ये तो
बातों
दिल
को
की
blow
भड़ास है जो आपके सामने निकाल रहे हैं, किसी और के सामने
भड़ास
नहीं।
तो ठीक है, पर ये भी भड़ास है कि इस कंट्री में 66 करोड़ पीपल ने गंगा में डिप किया।
Yes.
And on an average, a lady of 50 years has walked 6 to 10 kilometers before having a dip। और तभी ऐसे थोड़ा सा कहते हैं कि जब हम लोग कहते हैं कि भैया ये तेरा काम हो जाएगा, मैं सोचूंगा गंगा नहा लेंगे।
हाँ,
तो ये हमारे एल्डर्स कुछ
elders
गंगा
कुछ
नहाना कोई आसान नहीं था पहले।
नहीं आसान है।
गंगा स्नान के बारे में बात करते होंगे तो इसी तरह से आई होगी गंगा स्नान के बारे में। हम कहते हैं ना भाई ये तेरा काम पूरा हो जाएगा तो मैं सोचूंगा मैंने गंगा नहा ली।
बिल्कुल।
तो मच डिफिकल्ट, हमारे अभी से नहीं, पुराने टाइम से भी डिफिकल्ट होगा।
बिल्कुल ठीक
तो
है।
आई थिंक विद दैट पर्टिकुलर गुड नोट, मैं तो एक छोटी सी बात कहती हूँ, चाहे वो कैनेडी ने अमेरिका में बोला हो, चाहे अब्दुल कलाम ने यहाँ बोला, डोंट आस्क मी व्हाट कंट्री हैज गिवन टू यू, Please tell me what you are going to give to the country.
Yes.
And each one of you who is sitting here, if you are a specialist, the government has spent 4 crores of rupee on you. And if you're MBBS, the government has spent 2 crores on you. How much are you going to give back? जिसने 4 करोड़ के इससे पढ़ी है बिना पैसे देकर, उसको 40 लाख रुपए साल में देना है सरकार को.
We are ready to give, ma'am. We
आप
are ready.
दोगे तो मुझे नहीं मानो.
We are ready to give, ma'am.
बिल्कुल
हाँ,
ठीक है.
मेरे पिताजी तो एक ही चीज कहते थे कि आपको हर कमरे में लगा के रखना चाहिए कि इतना पैसा सरकार ने तुम्हारे पर खर्च किया. डॉक्टर साहब, हमारे पेरेंट्स के जो एक आदमी काम करता था, 4 बच्चे होते थे, तो वो इतनी एजुकेशन थोड़े दे सकते थे. वो ये कहते थे भाई क्लास में अच्छे नंबर होंगे तो तुमको बेस्ट ऑफ एजुकेशन मिलेगी, और क्लास में अगर आप अच्छे नहीं होगे तो भैया आपको बोरी ढोनी पड़ेगी, ये तैयार हो जाओ उसके लिए.
यही बोलते.
तो डॉक्टर साहब हम लोग तो इसलिए पढ़ लिए डॉक्टर साहब. But this is what I want to tell you, that each one of you should definitely say. हमारे डॉक्टर लक्ष्मी है, उन्होंने, मैंने कल लक्ष्मी से कहा था, लक्ष्मी ये लड़कियां नखरे करती हैं, उनको सबको लिख के भेजो, उनके घर में लिख के भेजो कि तुम्हारे पर सरकार खर्च करती है 1 लाख रुपए पर साल तुमको एक बीए के 1 क्लास करने के लिए. डॉक्टर साहब जब तक ये जानेंगे नहीं तब तक कुछ नहीं करेंगे. ये डॉक्टर साहब जानना बहुत जरूरी है,
जानना बहुत जरूरी.
रिस्पॉन्सिबिलिटी तो लेना बहुत जरूरी है डॉक्टर साहब. बिना रिस्पॉन्सिबिलिटी लिए कुछ नहीं होता. डॉक्टर साहब इस कुंभ में 5,000 करोड़ नरेंद्र मोदी ने यूपी गवर्नमेंट को दिया. यूपी गवर्नमेंट ने अपना थोड़ा और बजट लिखा. उन्होंने कभी ड्रीम में भी नहीं सोचा था कि उनको 4 लाख करोड़
वापस मिलेगा.
नहीं मिला, मतलब वहां के लोगों ने कमाया है. एक
हाँ,
दातुन बेचने वाले ने बताया कि 4 दिन में मैंने दातुन बेच के उसने
मैम वो तो बेस्ट था. वो तो बेस्ट था. गर्लफ्रेंड के लिए उसने बॉम्बे नहीं गया. वो तो बेस्ट था.
बहुत ही बढ़िया. नहीं डॉक्टर साहब, एवरीबॉडी हैज डन
मैम
दैट.
किया, ये ट्रू है. ऐसा बहुत लोगों ने किया. बाइक वालों ने कितना कमाया मैम. वो मेरा बाइक से एक बात हो रही थी मेरी, हम गए तो दे सेड मैडम हम तो पता नहीं 10 साल में इतना नहीं कमाते जितने हमने राइडर बन के कमा लिया.
हाँ बिल्कुल,
1 महीने में.
I think thank you very much. We are indebted to Dr. Indra Sareen again for another lecture. Dr. Vani, if you prepare another lecture, एक एरिया पकड़ लो कि भाई ये वो एरिया में बात करेंगे.
हाँ.
ये मैं आपको फिर वही अशोक की बात बताना चाहती हूँ. आपको 20 पॉइंट्स पता है, पर किसी ने नहीं बताया कि 20 पॉइंट्स आपने एक ही टॉक में खत्म करने हैं. Am I clear? 5 पॉइंट करो कि आज हम यही वाली बात करेंगे.
बिल्कुल ठीक.
ठीक है. थैंक यू सो मच.
Thank you.
Again,
Thank you, ma'am.
Forum is indebted to all of you.
Thank you, ma'am.
Thank you,
Thank you so
speakers.
much. Thank you so much.